Good afternoon, everyone, and thank you for joining us. Today we have a COVID-19 update, and I will outline a budget for immediate recovery needs. But first, an update on COVID-19. As of today, we have had 781,802 lab-confirmed cases, 5,495 new cases reported since yesterday, 2,630 people in the hospital, and sadly, 9,728 people who have died. Our hearts are with the families and friends of loved ones lost to this virus. We continue to be encouraged to see our numbers stabilize, but still they're too high. Wednesday marked the highest number of deaths recorded in a single day since the start of the pandemic. This virus is still spreading and costing lives, and it's critical that we keep taking it seriously. Before I discuss our budget proposal, I'll recognize Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to provide a brief COVID-19 update. Dr. Cohen.
Thank you, Governor. We released the updated COVID-19 County Alert System report today, and there's some good news in the report. As a reminder, the COVID-19 County Alert System uses a combination of 3 metrics to categorize counties: case rate per 100,000 people over 14 days, percent of tests that are positive, and a composite hospital impact score. Using these metrics, we then categorize counties into 3 colored tiers to describe their level of viral spread and their healthcare capacity impact. Red represents critical, orange substantial, yellow significant. Now this slide shows an updated county alert map. And for the first time since we started this report back in November, our trends moved in a positive direction. 2 weeks ago, 86 counties were red, and today that's down to 61. North Carolinians are working hard to protect one another, and we're seeing the results. But there is still a lot of work ahead of us. 94% of North Carolinian counties still remain red or orange with critical or substantial COVID spread. If we keep doing those 3 W's and everyone gets the vaccine when it's their turn and our supplies increase, we will get to the other side of this pandemic. So whenever you are with people that you don't live with, keep wearing your mask over your mouth and nose, wait 6 feet apart, and wash your hands often. Thank you, Governor.
Thank you, Dr. Cohen. I'm very grateful for your stellar leadership during all of this. As you can see, there are encouraging signs, but we know this pandemic has tested us, and we must remain vigilant. But I'm optimistic about our state's future. Our numbers are leveling, and vaccines are being administered every day. We can and will turn the corner on this pandemic, and our communities can be even stronger than before. But for that to happen the way we want, we must make strong investments now to help people and businesses recover. Today, we're recommending emergency recovery and resilience investments for a stronger North Carolina. It's really in 3 parts: defeating COVID, building back our people and our economy, and then looking forward to building a more educated, skilled workforce. As we remain focused on keeping people safe and healthy, we must work to ensure that our state is in the position to thrive both during and after the pandemic. We must make certain that North Carolina remains strong, resilient, and ready. This budget recommendation comes after consultation and input from both Republican and Democratic elected legislators and leaders, educators, health experts, businesses, workers, and more. It deploys both federal and state resources. The federal COVID relief package Congress passed in December provides more than $4 billion to North Carolina, and it can do a lot of good, and you'll see that in this package. In addition to the federal stimulus funds, we're recommending $695 million from the more than $4 billion in state funds that we have on the bottom line right now. It's close to $5 billion right now. People need help immediately, and we have both the means and the power to give it to them. With the virus continuing to spread rapidly and new variants identified throughout the country, we need to use the resources we have to slow its spread and protect public health. This funding can help us get more testing, more treatment, and more vaccines and arms. Nearly $700 million in federal funds will help us meet immediate testing and treatment needs, plus strengthen access to vaccines as we get more supply. People and businesses also continue to feel the strain financially. Many families are living on the edge during this pandemic, and we can do more to help businesses and keep people in their homes. Last year, we recognized that thousands of North Carolinians were threatened with eviction or power shutoffs during the pandemic. My administration created the HOPE program with federal funds to make payments directly to landlords and utilities to keep people in their homes, and it has already helped over 35,000 families. This program is a national model, and Republican leaders in the state legislature are already recognized this and are rushing more funds to it. The $546 million in federal dollars in our proposal today will help this effort. We also know how many small businesses continue to suffer during the pandemic. The federal stimulus extended the Paycheck Protection Program, or PPP, but I propose we invest $37 million more in emergency state funds to support small businesses with a focus on historically underutilized businesses, and market our great tourism and hospitality industry, which has been hit so hard by the pandemic. And we know bars and restaurants are hurting, and this budget proposes eliminating ABC permit fees, which will save them about $25 million. More help is also needed for schools and educators, and we're proposing nearly $2 billion for emergency assistance for public and private K-12 schools and higher education in our state. But North Carolina should also use state funds to step up for our educators. In the last year, our teachers and school staff, along with community college and university workers, have gone above and beyond. Teachers have always been our heroes, but throughout this pandemic, they have underscored their courage and commitment to educating our children. And bus drivers are getting up early and taking meals to families and kids to schools. Custodians are working hard to keep classrooms clean and sanitizing. I'm proposing one-time bonuses of $2,500 for teachers and principals, $1,500 for school personnel in public K-12 schools, and $2,000 for workers in our community colleges and universities. These are the only state employees who did not get raises the last 2 years. And we need this boost to help keep them on board and reward their hard work. Our recommendation also includes funding to expand access to child care and provide more support to our families. It also includes funding for food assistance, such as SNAP and school nutrition, as well as our food banks that are helping more people than ever before. The need for access to high-speed internet everywhere is more apparent than ever, with remote learning, the explosion of telemedicine, and the need for small businesses to reach national and global markets. Our budget proposes $30 million in emergency investment to extend high-speed internet and for 35,000 hotspots for education. Now, we need a significant bond package for a long-term fix, and we'll talk more about that as the legislative session progresses. Even before the pandemic, North Carolina had some of the shortest and stingiest employment benefits in the country. Now's the time to fix this and provide a real safety net. North Carolina's massive unemployment insurance trust fund balance can get people help right now. This budget proposes extending the maximum duration of benefits to 26 weeks and increasing the maximum benefit from $350 to $500 a week. This budget proposal provides the steps to not only defeat this pandemic, but shape a stronger future for our state. I've seen the relief on faces of seniors when that vaccine goes into their arms. I've talked to volunteers at food banks who are serving people who have never had to ask for food in their entire lives. I've heard from small business owners living on the edge to keep their employees hired and their life's work alive. I've Zoomed with friends who've lost family members to COVID who had to be apart from them when they died. I've talked to people who received an unemployment check for the first time ever, who said they needed it simply to stay afloat. It's time to help all of these North Carolinians and more. It's time to get healthier and stronger. I know we can do it. As I mentioned before, State Budget Director Charlie Perouse is with me today. For those following along, you can go to osbm.nc.gov to get the details of this proposed budget. Also with me today is Secretary of the Department of Public Safety Eric Hooks, Commissioner of Prisons Todd Ishii, Monica McGee and David Payne are our sign language interpreters, and Erica Kugler and Margaret Roberts are our Spanish language interpreters. Before Charlie goes through with his longer budget presentation, I'll pause to take a few of your questions. Right now, we'll do that now. Once we've gotten through as many of those as we can, I'll turn it over to Charlie to go through more of the details of the budget proposal. So if you can identify yourself and your organization, we'll take the first question.
Our first question is from Liz Schlemmer with North Carolina Public Radio.
Okay, still waiting for that question.
We'll try Lana Harris from WCNC.
Hi there. Yeah, Lana Harris from WCNC. So my question has to do with vaccines. One of the issues we've heard with seniors specifically is that, of course, not all of them are technologically savvy. Some don't have email, and it's becoming a bit of a barrier to getting signed up for vaccines. So my question is, have you all seen this becoming an issue in North Carolina, and what are the options for seniors who are having problems with that online process? And I do have one quick follow-up question on that too.
The team is working very hard to make sure there are many avenues for seniors to make appointments for vaccines, but I'll let Dr. Cohen talk about that a little more specifically.
Hi, Lana. Thanks for the question. Yes, so there are many of our vaccine providers that are working with their community partners to make sure that our seniors are getting in for vaccine appointments. I want to remind folks that supply continues to remain very low, so there aren't a lot of appointments, but we're seeing great partnerships, whether it's with our faith community and their churches across the state, or our community action agencies, our federally qualified health centers, others who know their communities well and are making sure that we can proactively get folks in for appointments. So it's definitely something on our radar and one that we are watching very closely, but I know our vaccine providers are very sensitive to. I will say we continue to know there are a lot of those who are over 65 who want to still get vaccines, and that is why we continue to focus on that group, but supplies remain limited, and so I know that we're going to be working on this for a while. Thanks.
And there was a follow-up?
Yes, thank you. I've seen in other states where organizations, you mentioned community partners or ordinary people, have created initiatives to just help seniors get set up for vaccines. Do you encourage the community to do that just for the people who they know around them who may or may not be able to get vaccinated, or what can we do to really say, hey, if you're a senior, you can't get online, you're not able to get the phone to work, here's what you can do. Thank you.
It is fantastic for family and friends to help seniors to get appointments and to try to take them there. We've set up, our Department of Transportation is giving rides to people who need them to get them to their appointments. The team is making significant efforts to get to underserved communities. We know that with such a small supply of vaccine and such significant demand, that people who do have access to the internet and have time and the ability often are more successful in getting appointments. I think the team realizes that. So there is a lot of focus on getting vaccine to our federally qualified health centers that often serve these underserved communities. And we do encourage people to try to help seniors, and particularly those who can't look after themselves. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. Two questions. One on the vaccinations, and of course, you know that teachers are asking about when they're in line next, and that's a few weeks away. Is there a plan for the logistics of having them vaccinated at work? Then also, Governor Cooper, you vetoed the bill to make death investigation records secret. Do you oppose the effort of the Forsyth DA to block your administration from releasing records?
So as to the vaccines, I'll let Dr. Cohen answer that question, but I did not hear your second question, Dawn. What case is this you're talking about? I'm sorry.
John Neville death investigation and the Forsyth County DA that's blocking your administration from releasing records about it.
Okay, I'll have to get information about that. I'm not familiar with that situation, but we'll get information to you, and I'll let Dr. Cohen take care of the vaccine question.
Hi, Dawn. As you rightly point out, we continue to vaccinate those that are 65 and up, but the next group is our frontline essential workers. Those are folks that can't stay home to do work. There are teachers, our police officers, our firefighters. As we think about moving into that group, which we know is still a few weeks away, there are going to be a different ways in which folks are going to operationalize this in their counties and with their vaccine partners. We're hearing about some that are going to go to school sites and do vaccinations there. Others will invite them to existing vaccine site administration. So I think it will be a mix. We're working through some of those operational best practices now and hope to be able to share more as we get closer to that point. Thank you.
Next question, please.
Our next question is from Andrea Blanford with ABC 11.
I was hoping you could respond more directly to the North Carolina Association of Educators, whose president told our reporter last night teachers are very disappointed at urging the return to in-person learning without first prioritizing their vaccination. What would you say to them?
Well, first, I am so grateful for our educators, not only our teachers and principals, but the frontline school staff who's been working so hard. They've been heroes. I've been a fighter for our public school educators. The proposal that we've made provides significant safety guidelines for educators in our public schools, and it is based upon research that has occurred that shows that going back to school and getting students in the classroom can be done safely with the appropriate health protocols that are in place. And in addition, we know the bad things that are happening with our students with depression and with not reporting child abuse and all of the things that educators in the classroom can do for our students that's hard to do remotely. I want to continue to work with our educators to keep them safe. I know I've talked to many of them who believe it is their mission to help educate these children. One of the things I'm doing today is proposing these immediate one-time bonuses for our educators. They were left out of pay raises the last 2 years, and we need to get them help and to show them how much we appreciate them, which we do. And we're continuing to push the administration hard to get us more vaccine in North Carolina. We want to get to teachers and other essential workers as quickly as we possibly can. And I know that that strong effort is going to be made. Next question, please.
We have a follow-up, Andrea Blanford, ABC 11.
Thank you for that. On the flip side, what do you plan to do with that proposed school bill that's working through the General Assembly right now requiring schools to reopen? Thank you.
I have concerns about that legislation because just as you mentioned earlier about teachers being concerned to go back, that bill doesn't follow the guidelines that the Department of Health and Human Services has put out there, particularly for our middle and high schools. So I'll have to wait and see what the final bill looks like when I get it. I don't think it's even out of the Senate yet. And what we want to do, the good thing is, I think we all want to get our children back into the classroom, and we want to do it safely. But in order to do that, we need to follow the health guidelines that's been set out by the department, and this legislation doesn't do that. Next question, please.
Our next question is from Ashley Talley with WRAL.
Thanks for taking my call, Governor. Following up on Andrea's question about the bill going through the House or the Senate right now, a lot of superintendents are saying that it's impossible to maintain those 6 feet of distance in their classrooms and on their buses. How do you see all 115 school systems in North Carolina going back with caveats like this for middle and high school grades?
Thanks for that question. We're seeing this being done successfully throughout the state all along. In our middle and high schools, some systems are having our students there on certain days and other students there on other days. In some systems, there are enough people that want to keep their children at home that they're able to do social distancing in middle and high schools. And we've got to stick to the science and to the research. And I think our health officials, I'll let Dr. Cohen come up and comment on that, but I think they feel pretty good about the research regarding elementary children and be able to be back in class with the appropriate health protections. But they remain concerned about middle and high school. They want them back in the classroom too, but that social distancing is an important part of that. Dr. Cohen, would you want to speak to that?
Hi, Ashley. As you point out in your question, for our middle and our high school, we are saying we want to have all of those safety protocols that we use in elementary, plus we want to make sure we're keeping that 6 feet of social distance when kids are in their classrooms. And we have seen folks be able to do that successfully. Again, we are looking at the science and the data that shows that transmission in middle and high school is closer to what we see in adults, which is why we want to maintain that 6 feet of distance. I'd also emphasize that it is particularly the sports is where we are seeing more transmission of virus. But when you're in school and you're maintaining 6 feet and you're wearing your mask, we're seeing very little viral spread. And that is how we can get our kids back in the classroom safely. And so that's why there's a difference between middle and high school versus what we're seeing in elementary school. And as I said, there are many ways to approach that 6 feet of distance, as the governor said. Some are doing some kids in different cohorts, but depending on the school district, if your classrooms are larger and you're able to spread out, or if you have folks who are opting in to that virtual learning and you just have less folks, you could be going each and every day in middle and high school as long as you're maintaining that 6 feet of distance. And again, this is why we're just wanting to maximize the safety protocols and get our kids back in the classroom. Thanks.
Thanks. Next question, please.
Our next question is from Jeff Tabiri with WUNC.
Hey, Governor. Jeff from WNC here. I'm going to potentially ask my colleague Lee Schlemmer's question here in a moment, if that's okay as a follow-up. But I wanted to double back first to the budget proposal or some of the provisions that you laid out earlier. You mentioned the $695 million in additional state funds, and then this one-time bonus effort for teachers and principals, university and community college workers, and then school personnel. And I gather that you and your staff have been having some conversations with legislative leaders. I'm wondering if you can shed a little light on, are they in agreement with this 695 number and these one-time bonuses, or where's the legislature with this?
I'll have to let them speak for that, but they know about this proposal, and in fact, we've been very transparent with them and have solicited their input. I've directed our budget staff to let Republican and Democratic legislators know what we're doing and getting input from them. I see a lot of support for this on both sides of the aisle. I think some of them are wanting to see the consensus revenue forecast before making a decision, but that's coming up very soon. We believe that that's going to be very strong, and we have this over $4 billion, almost $5 billion in unreserved cash in the general fund right now. So what we're proposing for immediate needs is $680 or so million out of the almost $5 billion that is there. So this is not an unreasonable request in an emergency situation, and particularly since these educators did not get raises over the last 2 years, we think it's really important in order to try to keep them on board and to reward their good work, that this bonuses be a part of this emergency appropriation. And I hope we can work on that, because I know that a lot of them want to help our educators. We had disputes over the budget last time, and I think this is an important signal to send. And what's your follow-up, Jeff?
I appreciate it. When it comes time to vaccinate frontline essential workers, including teachers, is anything being done? Will anything be done to prioritize those with 2 or more high-risk health conditions?
You know, we know that particularly vulnerable frontline workers are people that we need to make sure that we provide vaccines for. I'll let Dr. Cohen talk about that. We're working with our providers. There will be some flexibility there, but Dr. Cohen, if you can address that.
Hi, Jeff. Thanks. So again, just to reiterate, we're currently vaccinating those that are 65 and up. The next group that we would get to are our frontline essential workers. We know in that category of folks that there are those with multiple chronic conditions. We at the state level are not going to be sub-prioritizing within that group, but we know that we will work with our vaccine partners in order to operationalize this. And we know it's a big group. There's a lot of teachers, a lot of police officers, a lot of firefighters, so that we want to make sure that we can get this as orderly as possible. We're hoping to put out some best practices, but we will not be sub-prioritizing at the state level, but we will work with our vaccine providers to make sure that they can be getting to folks. I want to reiterate, the supply is very low, so we're not going to get to everyone the first day, the first week. It's going to take us a while in order to be able to vaccinate everyone that wants to, but we're going to work as fast as we can and demonstrate to the federal government we need more vaccine here for North Carolina. Thank you.
Next question, please.
Our final question for this portion of the Q&A will be from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Thanks so much for the time and taking this question from me. Governor, as you know, the Senate just passed, well, there's a bill on your desk right now for COVID relief, and looking through your proposal, there's some things that are exactly matched dollar for dollar with the elementary secondary emergency relief fund for $1.6 billion and the $95 billion to HHS for vaccines. Are you planning on signing this bill and then following up with lawmakers with some of your ideas, or do you plan to veto this bill and hope they regroup to incorporate more of your ideas?
So they told me they were going to go ahead and pass legislation to appropriate this money. I'll have to look at the bill to make sure I know everything that is in there, but I'm in full agreement with them appropriating that money. And if we did anything with that bill other than sign it, it wouldn't be because there's a dispute over when it was passed. We're glad that they have appropriated those funds that are already a part of this. So I look forward to reviewing that bill before making a final decision on it. And I also look forward to working with the legislature. We think that a lot of these ideas here are ones that have been mutually discussed with both Republican and Democratic legislators. So we hope that we can come together on legislation that appropriates this money. You have a follow-up, Brian?
Yeah, just a quick one for Dr. Cohen. Do you know when we might see that next Group 3 prioritization come out? We're hearing reports it could be in a couple weeks. Have y'all talked about when that might occur?
Thanks, Brian. So we have actually surveyed all of our vaccine providers to ask them about the demand that they are seeing from those who are 65 and up, those that are currently vaccinating. And what we've heard from the vast majority is that there's still so much demand from the current group that we are in. And so I think it's going to be a few weeks until we're able to move forward to our frontline essential workers. So we're going to keep working hard on those that are 65 and up. It's good that we have additional vaccine coming to the state, a little bit more from the federal government. We're going to be prioritizing speed and equity over these number of weeks, and then we'll continue to ask our vaccine providers what kind of demand that they are seeing. We'll look at our data and then make a final determination as we go forward. Thank you.
And I'll repeat one more time, Dr. Cohen and I have said this a lot, but we want to get people 65 and over vaccinated because that's where we're seeing 83% of the deaths right now in North Carolina from COVID-19. Appreciate all the questions that we've gotten, and now I'd like to invite our budget director, Charlie Perouse, to give you more detailed information on the budget that we're proposing, and I know he'll be available for more budget questions at the end of the presentation. So, Charlie?
Thank you, Governor, and good afternoon, everyone. This supplemental budget proposal is another important step in the state's continued fight to combat the effects of the COVID-19 pandemic. Following the passage of the Federal Consolidated Appropriations Act of 2021, North Carolina anticipates receiving an additional $4 billion in federal funds. Almost 90% of these federal monies are slated for education, emergency rental assistance, and vaccine, testing, and tracing services. A summary of the federal fund amounts are included on page 1 of the summary document that the Governor mentioned was on our website. The Governor is also recommending a handful of other COVID-19 and time-sensitive items totaling $695 million. They are broken down into 3 main areas: $468 million for critical education services, $82 million to strengthen our people and economy, and $145 million for continuity of state government operations. Specifically, $486 million would support one-time bonuses for 200,000 educators statewide, including $2,500 for all public school teachers and principals, $1,500 bonuses to non-certified public school employees, and $2,000 bonuses for all UNC system and community college employees, both faculty and staff. This is about respect and appreciation for employees who have taken on the exceptional responsibility of teaching and supporting our students during a very difficult time. This proposal also provides assistance to help rebuild and strengthen our people and economy. For small businesses, it includes $11 million to fully fund the Rural Center's Rapid Recovery Plan, and an additional $20 million to support historically underutilized businesses as part of the Retool NC program. To help the financially impacted restaurant and bar industries, the Governor recommends waiving annual ABC renewal fees for the upcoming license period, saving them about $25 million. It includes $3 million for small business counseling, as well as $3 million to market North Carolina agricultural products and cultural attractions, and our state's position as a business and tourism destination. High-speed internet access continues to be a pressing need, and this recommendation provides $30 million to improve connectivity at rural community colleges, libraries, and to purchase 35,000 student hotspots. This proposal also includes $10 million to support food banks statewide and $4.5 million for housing assistance. Finally, in this area, the Governor recommends modifying the state's unemployment insurance program. This includes increasing the maximum weekly benefit from $350 to $500 per week and adjusting the maximum number of weeks an individual can receive benefits to 26 weeks. This can be done while accelerating the decrease in the base rate paid by employers while keeping the UI trust fund balance above $2.5 billion. The pandemic continues to put great pressure on other government services. This proposal includes $50 million to continued hazard duty pay for public safety staff. It recommends almost $65 million to reimburse the state health plan for COVID-19 related expenses. The package also requests $20 million to purchase supplies, information technology, and other equipment to protect employees and citizens. In addition, it recommends $2 million to support fee-supported entities like the state fairgrounds, museums, and zoo. And finally, it appropriates $1 million to the state treasurer's office to assist struggling local governments. Thank you. I am happy to answer questions you may have.
We'll remind our reporters on the line, please press 1 to ask a question. Our first question is from Tess Bargerbor with Fox 8.
Good afternoon, Tess Bargerbor, Fox 8. I wanted to ask a question about some of the vaccines in long-term care facilities. I understand that some counties, specifically here in the Triad, have stepped in to help vaccinate facilities that did not enroll in CVS or Walgreens programs. I was wondering if the state knew how many living facilities still knew how many facilities needed vaccines, and if that's taking any significant number of doses away from other providers.
Thank you for your question. I think that's best suited for Dr. Cohen, and we'll make sure she has that question and we'll respond back to you quickly. Thank you. Next question.
We've got a follow-up, Tess Bargerbor, Fox 8.
My apologies. I've been trying to ask my questions previously, so you can disregard my follow-up. Thank you.
Our next question is from Dawn Vaughn with the News and Observer.
Yeah, I wanted to ask about what the governor said at the beginning of the presser about the $4 billion. Is that the state funds? Is that, I'm sorry, the $695 million. Is that from the rainy day fund? And why are state funds needed if there's federal money and then also probably more federal money coming down?
Thank you for your question. Yes, the $695 million is recommended to be appropriated from the unappropriated cash balance in the general fund, which is standing at $5 billion currently. We put together this package recognizing that the federal stimulus package covers a lot of things, but there are a handful of donut hole areas where federal monies do not cover them, and we think many of these items are time sensitive, and given the money on the bottom line, the governor recommends appropriating just under $700 million of this $5 billion cash balance in the general fund. Next question.
Our next question is from Travis Fain with WRAL.
Yeah, hi, thanks, Charlie. So I've come into this call very late and we'll have to catch up, so forgive me if I'm trotting over old ground here. But the money laid out in this press release that's come over, including the $2 billion for education, is that in addition to what passed the House today, the $1.6 billion for education? And is this on top of that, or is it inclusive of that?
Travis, it's inclusive of that. The bill that the legislature passed today appropriates a portion of the $4 billion that we expect to receive from the federal government. They included in this first bill a handful of federal appropriations that they deem time sensitive, that education money as well as the emergency rental assistance money. And so they went ahead and appropriated that in this first bill. And it's our understanding that over the next couple weeks, as they look through the proposal that the governor is outlining today, they'll look to appropriate the remaining $4 billion of the federal monies, as well as review the $700 million general fund package that the governor is announcing today. Next question.
We have a follow-up, Travis Fain, WRAL.
Thank you. Do you know when the revenue projections are due? Is that the next couple of weeks?
Yes, sir. my staff in the Office of State Budget Management is working very closely with the Fiscal Research Division at the legislature to come up with our consensus revenue forecast, which we hope will be completed. Our goal is by the end of next week, so by the February 10th or February 11th timeframe. And that would be for the current fiscal year as well as the revenue forecast for fiscal years 21, 22, and 22, 23. Next question.
Our next question is from Laura Lee with Carolina Public Press.
Good afternoon, it's Laura Lee from Carolina Public Press. In terms of the $546 million for emergency rental assistance, which this press release says will build on the current work, is that going to reopen applications for the HOPE program? Or is this, I mean, the way the press release is phrased makes it sound like perhaps it's already accounted for funding.
Yeah, good question. We're still working through the details and guidelines of the emergency rental assistance program. But in the short answer, our goal is yes, to open this up. The HOPE program that the governor mentioned is a leader in the country. We were actually out in front of the federal government on this by establishing this emergency rental and utility assistance program back in the fall. That HOPE program received about $200 million in requests and currently have gotten out about $125 million of that. This $540 million we hope will be on top of that as well. There are some differences between what some of the HOPE guidelines were versus the emergency rental assistance guidelines that the federal government has provided. We're trying to match those up to make sure we reach as many people as we can with this assistance. We continue to make it the system more user-friendly where folks can fill out it electronically online. And we've also set up easier ways for people to get in touch with their landlords and utilities to get this assistance. So, you know, over the next few weeks, when we have more guidelines from the emergency rental assistance program, we would anticipate rolling it out and getting more applications in for assistance. Next question.
We have a follow-up, Laura Lee, Carolina Public Press.
And a follow-up actually about the $700 million for vaccine and testing, COVID-related expenditures. How much of that will be for CVMS, and are there projections about how much more the CVMS system is going to cost?
I'm not familiar with the exact allocation amounts for those numbers, and we can work with our DHHS. I know they have a detailed plan to get you that direct information. What we do know is the federal government has provided some guidance on how that $700 million is to be allocated. We have a very detailed state plan that talks about the expenditure plan for that $700 million, and that is we anticipate to be stretched out over the next 2 or 3 years. And so that $700 million would be spent over the next 2 or 3 years in administering vaccines statewide, as Dr. Cohen and the governor mentioned earlier. Next question.
Our next question is from Brian Anderson with the Associated Press.
Hi, I'm just wondering if you could articulate what happens in the event that Congress does pass another stimulus relief package. I know there's the proposal from Republicans at $600 billion and Biden at $1.9 trillion, but if something gets passed, would the state need to spend this money from its own funds for the direct payments to teachers and staff? Or could that come from a future stimulus from the federal government?
That's a tough question to answer. Obviously, the known right now is the federal stimulus legislation that was passed and signed in December. Obviously, we're keeping a close eye on the next stimulus proposal that was presented by President Biden, is currently being discussed in Congress. Obviously, North Carolina wants to maximize the use of federal monies and use federal monies first before appropriating state monies for things that the federal government might cover in the future. It's a little bit hard to know about timing, Obviously, we would anticipate if the feds pass another stimulus in the next couple of months, that would interact very closely with the 2-year budget that the governor is scheduled to present to the legislature in the early to middle March timeframe. So it's a sort of a wait to be seen. What we have seen, though, is that the recent stimulus money that the feds have provided have had very limited flexibility. They're for specific programs and specific populations and haven't allowed the state much flexibility to put them in things like compensation increases or educator bonuses like we've seen. Right now, there's no federal money that we have got or anticipate receiving that could be used for that. And so, we'll continue to work through the process. We're hopeful that the feds will pass another federal stimulus. We have a lot of state needs out there, as we've mentioned earlier, and we hope to have more information over the next several weeks and incorporate that into the long session budget in March. Next question.
Our final question today will be from Lake Wood with NC Ag Weekly.
Thank you. Lakewood here with NC Ag Weekly. This question is more for Dr. Cohen, and I understand that she might not be able to give me an answer right away, but I do want to ask this. We have heard from many individuals from across the rural parts of the state that say they have either not been able to set up an appointment to get the vaccine, or they did have an appointment and it was canceled due to the provider not having an adequate amount of vaccines on hand. But yet there are mass numbers of the vaccine being administered in other areas like Mecklenburg County. My question specifically is, what is the North Carolina Department of Health and Human Services doing to ensure that these individuals in rural communities are receiving the same attention as those in more urban areas?
Thank you for your question. We'll make sure we get that to Dr. Cohen and her team and have an answer to you as soon as possible. I do know from the budgetary standpoint in the plans that we've seen for disseminating the vaccine and utilizing that $700 million of federal money, there are targeted expenditures for outreach for rural and underserved communities. That's a very top priority for the governor and Dr. Cohen, and we look forward to giving you a more detailed answer shortly. Thank you very much, everybody. As mentioned earlier, the detailed budget recommendations can be found on our OSBM website. Hope everybody has a great rest of the day. Thank you.